You may not even realize how dangerous high blood pressure, which you may consider normal, can be. Stop taking your blood pressure medication exactly the way your doctor told you to before you hear this. I know that sounds reckless coming from someone in my position, but stay with me for the next few minutes, because what I'm about to share could change how you think about every number on that little screen at your pharmacy's blood pressure machine. I'm a physician who has spent over 2 decades treating patients over 60, and I want to start with something that stopped me cold when I first read it. A landmark study called the SPRINT trial, funded by the National Institutes of Health and published in the New England Journal of Medicine, followed more than 9,000 adults with high blood pressure, average age just under 68. Half were treated to a standard target of under 140 for their top number, systolic pressure. The other half were pushed to a much tighter target, under 120. The intensive group saw significantly fewer heart attacks, fewer cases of heart failure, and a lower risk of death from any cause. In a follow-up analysis focused specifically on adults 75 and older, the numbers held up just as strongly. That's not a marginal finding. That's a study telling us that the old idea of a little high is fine once you're older may be quietly costing people years of their lives. But, and this is where it gets complicated, and where I think a lot of well-meaning advice online gets it wrong, there is also very real danger in pushing blood pressure too low in an aging body. I've watched patients faint in their bathrooms, fracture hips, and lose independence because their pressure was driven down too aggressively, without accounting for how a 75-year-old body regulates blood flow differently than a 45-year-old one. So today I'm going to walk you through what too high actually means after 60, what causes those frightening sudden spikes, the real damage untreated high blood pressure does to your brain, kidneys, and heart. And then, this is the part I really want you to stick around for. The natural, practical, doctor-backed ways to bring your numbers down without medication side effects wrecking your quality of life. Number 2 on today's list involves a mineral most people over 60 are dangerously low in, and it may matter more for your blood pressure than sodium does. I'll explain exactly why when we get there. Before we go further, I want to ask you something, and I mean this. I read every single comment on these videos. Tell me your age, and tell me this. Has a doctor ever changed your blood pressure target as you've gotten older? Or have you been on the same number since your 40s? I want to know because it tells me a lot about how differently this is being handled from clinic to clinic. And honestly, some of what I see in the comments ends up shaping future videos. Let's talk first about what too high really means once you're past 60, because the honest answer is, it depends. And anyone who gives you a single number without context isn't telling you the whole truth. Generally speaking, most cardiology guidelines consider a reading above 130/80 to be elevated, and anything consistently above 140/90 to be a clear case of hypertension requiring treatment. But here's the nuance the SPRINT researchers themselves wrestled with. For adults over 75, especially those who are frail on multiple medications or prone to dizziness, the goal isn't always the lowest possible number. It's the lowest number your particular body can tolerate without symptoms. Think of your blood pressure like the water pressure in an old house. Crank it up too high and pipes burst. Crank it down too low in an old house with aging plumbing and the water simply doesn't reach the upper floors, meaning your brain, in this analogy, doesn't get adequately perfused, and you feel foggy, dizzy, or unsteady on your feet. Now let's talk about why blood pressure spikes suddenly in people over 60, because this catches so many families off guard. As we age, our arteries lose elasticity, a process called arterial stiffening. A younger artery behaves like a flexible garden hose, expanding and contracting smoothly with each heartbeat. An older, stiffer artery behaves more like a rigid PVC pipe. When the heart pumps blood into a stiff vessel that can't expand to absorb the pressure, the reading spikes. Add to that dehydration, which becomes far more common after 60 because the kidneys become less efficient at concentrating urine and the thirst signal itself weakens with age. Add underlying inflammation, poor sleep, sleep apnea that's gone undiagnosed for years, sudden emotional stress, excess sodium from processed food, and certain over-the-counter medications like ibuprofen, which can raise pressure through fluid retention. All of these converge on an aging cardiovascular system that simply has less buffering capacity than it did 30 years ago. And the harm from letting high blood pressure run unchecked isn't abstract. It is, quite literally, a slow demolition project happening inside blood vessels every single day it goes uncontrolled. In the brain, chronically elevated pressure damages the small vessels feeding deep brain structures, and research following the Sprint Mind cohort found that intensive blood pressure control meaningfully reduced the risk of mild cognitive impairment compared with standard treatment. In the kidneys, sustained high pressure scars the delicate filtering units called nephrons, and once enough of them are damaged, they don't regenerate. In the heart, the left ventricle, the main pumping chamber, has to work harder against elevated resistance, and over years it thickens and stiffens in a process called hypertrophy, eventually setting the stage for heart failure. This is why I tell patients that blood pressure is the one number in medicine that keeps score silently. You don't feel your arteries thickening. You don't feel your kidneys losing nephrons. You just wake up one day and the damage has already been done. So let's get into what actually works. I'm going to count down 5 practical science-backed strategies, starting at number 5 and building to the single most powerful one, the one I genuinely believe deserves far more attention than it gets. Number 5. Rethink sodium, but not the way you think. For decades, we've been told simply to cut salt, and while that's not wrong, it's incomplete. And treating it as the whole answer is why so many people cut back on salt and see almost no change in their numbers. Here's what's actually happening physiologically. The kidneys regulate blood pressure largely through the balance of sodium and water retention. After 60, kidney function naturally declines. By age 70, many people have lost roughly a third of the kidney filtering capacity they had in their 30s. A kidney with reduced filtering capacity holds onto sodium longer, which pulls in more water, which increases blood volume, which increases pressure. So cutting sodium matters, but the research increasingly points to the ratio between sodium and potassium as the real lever. A well-known DASH diet trial funded by the National Institutes of Health found that a diet emphasizing fruits, vegetables, and low-fat dairy while reducing sodium lowered systolic blood pressure by an average of 11 points in participants with hypertension, a reduction comparable to what you'd see from a first-line blood pressure medication. For practical purposes, that means swapping processed deli meats, canned soups, and restaurant food, which can contain more sodium in a single meal than you should have in an entire day, for whole foods seasoned with herbs, citrus, and garlic instead of salt. Pair this with adequate hydration because paradoxically, mild chronic dehydration causes the body to retain sodium more aggressively as a survival mechanism. So drinking enough water actually helps your body release excess salt rather than hoard it. Now let's move to number 4, and this one surprises almost every patient I mention it to. Your evening routine matters almost as much as your diet. Blood pressure follows a natural daily rhythm called a circadian pattern, dipping by 10 to 20% during deep sleep in a healthy cardiovascular system. But research out of sleep medicine centers has shown that a substantial number of older adults are non-dippers, meaning their blood pressure fails to drop at night, and non-dipping status is independently associated with higher rates of stroke and cardiovascular events. Why does this happen more after 60? Because sleep architecture itself changes with age. We spend less time in deep, slow-wave sleep, and conditions like sleep apnea, where breathing repeatedly stops during the night, become dramatically more common, affecting a large percentage of adults over 60, many of whom are never formally diagnosed. Each apnea episode triggers a stress response that spikes blood pressure repeatedly through the night, essentially training the cardiovascular system to stay in a heightened state. My practical advice: if you snore loudly, wake up gasping, or feel exhausted despite 8 hours in bed, ask your doctor about a sleep study. Beyond that, keep a consistent sleep and wake time, dim lights an hour before bed to support melatonin production, and avoid alcohol in the evening, since alcohol initially relaxes vessels, but causes a rebound constriction and spike in pressure a few hours later, often right in the middle of the night. Before we continue to numbers 3, 2, and 1, including the mineral I promised you earlier, if you're finding this useful, take half a second to hit subscribe and tap that like button. It genuinely helps this information reach more people your age who need to hear it, and it costs you nothing but a second of your time. All right, Let's continue. Number 3, move your body in a very specific way because not all exercise affects blood pressure equally in an aging body. Here's the science behind it. As we age, we experience a natural process called sarcopenia, the progressive loss of muscle mass, running at roughly 3 to 8% per decade after 30 and accelerating further after 60. Less muscle means fewer capillary beds for blood to flow through, which increases resistance in the vascular system, which raises pressure. On top of that, aging muscle develops something researchers call anabolic resistance, meaning muscle tissue becomes less responsive to the signals that normally stimulate growth and repair, making strength harder to maintain without deliberate, consistent effort. This is precisely why a landmark analysis published through the American Heart Association found that resistance training, combined with moderate aerobic activity like brisk walking, produced greater blood pressure reductions in older adults than aerobic exercise alone. The mechanism makes sense once you think it through. Building even modest muscle mass improves how efficiently the body clears glucose and manages insulin, both of which are tightly linked to vascular inflammation and blood pressure regulation. My practical recommendation is 2 to 3 short resistance sessions per week using light weights, resistance bands, or simple bodyweight movements like sit-to-stands from a chair, combined with a daily 20 to 30-minute walk. Timing matters too. A morning walk exposes you to natural light, which helps reset your circadian rhythm and supports that healthy nighttime blood pressure dip we talked about earlier. Pair your exercise with a small protein-rich snack afterward, because protein intake around activity helps counteract that anabolic resistance and gives your muscles the raw material they need to actually respond to the effort you're putting in. Let me tell you about a patient of mine, Harold, 73 years old, from a small town outside Sacramento. Harold came to me with a systolic reading regularly above 160, despite being on 2 medications. He told me flatly that exercise wasn't for someone his age. I asked him to try just 10 minutes of chair-based resistance movements and a short walk 5 days a week for 8 weeks, alongside the dietary changes we've discussed. At his follow-up, his systolic pressure had dropped to the mid-130s, and more importantly to him, he told me he could now carry his groceries up his porch steps without stopping to catch his breath halfway. That's the part that matters most, not just the number on the cuff, but what it means for actually living your life. Now we arrive at number 2, the one I teased at the very beginning, and I want to explain this properly because it's genuinely underappreciated. Magnesium. Most people over 60 are more deficient in magnesium than they realize, and it plays a far more direct role in blood pressure regulation than most people are ever told. Here's the physiology. Magnesium acts almost like a natural calcium channel blocker, the same class of medication frequently prescribed for hypertension, because it helps regulate how much calcium enters smooth muscle cells lining the blood vessels. When those cells absorb too much calcium, they contract more forcefully, narrowing the vessel and raising pressure. Magnesium helps keep that process in balance, allowing vessels to relax appropriately. The trouble is that after 60, magnesium absorption in the gut naturally declines, kidney excretion of magnesium can increase, and many common medications, including certain diuretics and acid reflux medications that are extremely common in this age group, further deplete magnesium levels. A meta-analysis examining multiple randomized controlled trials found that magnesium supplementation was associated with meaningful reductions in both systolic and diastolic blood pressure, with effects becoming more pronounced at higher doses within safe supplemental ranges. Think of magnesium like the tension knob on a guitar string, too tight and everything vibrates under excess strain. Magnesium loosens that tension just enough for the whole system to function smoothly. Practically speaking, magnesium glycinate is generally considered the gentlest form on digestion, and I typically discuss a dose in the range of 200 to 400 milligrams daily with my patients, always in coordination with their physician, since kidney function needs to be checked before supplementing, particularly in anyone with reduced kidney function. For synergy, pair magnesium with vitamin D, since vitamin D actually helps regulate magnesium absorption in the gut, and a large percentage of adults over 60 run low in vitamin D due to reduced skin synthesis capacity and less time spent outdoors, meaning the 2 nutrients genuinely work as a team rather than in isolation. And now, number 1, the single factor that in my clinical experience produces the most dramatic and sustained improvement, And it isn't a supplement or a food at all. It's stress physiology, specifically something called the chronic cortisol inflammation loop. Here's what happens as we age. The body's stress response system, governed by the hypothalamus and adrenal glands, becomes less efficient at shutting itself off after a stressful event. In a younger body, cortisol rises during stress and then drops cleanly afterward. In an aging body, that shut-off mechanism weakens, meaning cortisol lingers longer, and chronically elevated cortisol drives up blood pressure directly by increasing sodium retention and constricting blood vessels, while simultaneously fueling low-grade systemic inflammation. This matters enormously because inflammation damages the delicate inner lining of blood vessels called the endothelium, and a damaged endothelium produces less nitric oxide, the molecule responsible for allowing vessels to relax and widen. Less nitric oxide means stiffer, narrower vessels, means higher pressure, and the cycle reinforces itself. Researchers studying mitochondrial function, the tiny energy-producing structures within our cells, have found that chronic stress and inflammation together accelerate mitochondrial decline. And since blood vessel walls depend heavily on efficient mitochondrial energy production to maintain their flexibility, this creates a direct biological pathway from unmanaged stress to measurably stiffer arteries. This is precisely why I've seen patients whose blood pressure barely budged with medication alone show real, sustained improvement once we addressed stress directly. Through daily diaphragmatic breathing practice, just 5 to 10 minutes of slow, deep breathing, which has been shown in multiple studies to lower blood pressure by activating the parasympathetic nervous system, the body's natural rest and repair mode. Pair this daily breathing practice with time outdoors in natural light, which helps regulate cortisol's natural daily rhythm, and with maintaining real social connection, since isolation itself has been independently linked to higher inflammatory markers in older adults. I think of Margaret, 78 years old, from a quiet suburb outside Columbus, Ohio. Margaret had lost her husband 2 years before I met her, and her blood pressure had crept up steadily during that time, hovering around 155/92, despite taking her medication faithfully. We talked, and it became clear that grief and isolation were sitting underneath those numbers the entire time. She started a simple 10-minute breathing practice each morning, joined a weekly walking group at her local community center, and began speaking with a counselor about her grief. 4 months later, her systolic pressure had dropped into the low 130s, and she told me something I still think about. She said she finally felt like she was living again, not just existing while her body kept score. That's really what all of this comes down to, isn't it? Your blood pressure numbers aren't just statistics on a chart in a doctor's office. They represent your ability to walk your grandchildren to the park, to travel to see family without fear, to live independently in your own home for as long as possible, on your own terms. Getting older doesn't mean resigning yourself to declining health, and it doesn't mean chasing perfection either. It means understanding your body well enough to give it exactly what it needs. Whether that's a walk in the morning sun, a handful of leafy greens at dinner, a few deep breaths before bed, or simply picking up the phone to call someone you love. It is genuinely never too late to change this trajectory. I've watched patients in their 80s turn their numbers around meaningfully, and I've watched the quality of their daily lives transform right along with it. All of the studies I referenced today, including the SPRINT trial, the SPRINT Mind Cognitive Analysis, and the DASH diet research, are linked in the description below if you want to read them yourself, and I genuinely encourage you to. If this video helped you understand your own numbers a little better, subscribe, because I'll be covering more of these deep dives into the science behind aging well. And I want to leave you with a question for the comments. Which of these 5 strategies are you going to try first this week? And is there someone in your life you should be sharing this with today? I'll be reading, and I'll see you in the next one.